Hey everyone, Dr. Hagmeyer here, and if you're struggling to recover from long-haul COVID symptoms, what's now often referred to as post-viral syndrome, you're not alone. Many of my patients have lingering fatigue and brain fog, mood issues, months and months after their initial infection. And while we hear a lot about inflammation, mitochondrial dysfunction, immune system dysregulation, there's another key hormone we need to talk about today, and that's DHEA. In this video, I'm going to break down the role of DHEA in your body, how low levels can interfere with recovery, and what you can do to support your levels naturally and clinically if you've tested low in DHEA. So DHEA stands for dehydroepiandrosterone, and it's a hormone that's produced primarily by your adrenal glands, and it serves as a precursor to both testosterone and estrogen, both men and women. But DHEA just isn't about sex hormones. It plays a critical role in immune function and energy metabolism, brain health, stress response, and it typically peaks at around age 20 and then it gradually declines as we get older. However, certain stressors like a chronic illness and inflammation and infection and trauma, and yes, COVID-19 can cause your DHEA levels to plummet much earlier. Now, when DHEA levels are low, recovery becomes harder. Your immune system becomes more dysregulated. Inflammation gets out of control and can stay elevated. And you feel more fatigued and you feel more brain fog and you feel just lousy. So let's connect the dots here, right? Many people with long-haul COVID-19 report symptoms like exhaustion, poor stress tolerance, low libido, poor sleep, depression. Any of these sound familiar? These are your classic signs of low DHEA, but why does this happen? COVID-19 creates a perfect storm. It disrupts what's called the HPA axis, the hypothalamic pituitary adrenal axis, and that's your body's central stress response system. It triggers low-grade chronic inflammatory state. It pushes your adrenal glands to produce more and more cortisol, which is that fight or flight hormone, at the expense of DHEA. So even long after you've tested negative for COVID-19, your hormones are still trying to catch up. And without enough DHEA, your body struggles to regulate that inflammation, struggles to produce energy and rebuild and repair its body, all the things that DHEA does. So DHEA has some powerful immune modulating effects. It helps balance what's called Th1 and Th2 immune pathways. It helps enhance T cell activity, which can help, again, rein in autoimmunity, something that we're seeing a lot of in patients post-COVID. It also helps control something called interleukin-6 and TNF-alpha. Again, these are pro-inflammatory cytokines that are often elevated long after COVID. In simple terms, DHEA helps dial down that inflammatory response, helps your immune system return to a more regulated, healthy state. And that's not all. DHEA supports mitochondrial health, which again is vital if you're dealing with any type of fatigue or post-exertional malaise. So how do you know if your DHEA levels are low? Well, there are obviously common symptoms to look out for. These include things like persistent fatigue, even after rest, poor stress resilience, brain fog, memory issues, decreased libido, sexual dysfunction, mood changes, especially low motivation or just depressive symptoms. You may struggle with sleep issues or trouble falling asleep, insomnia. You may have reduced muscle mass or recovery after workouts. And if you're experiencing several of these, especially after COVID-19, it's worth testing your DHEA levels through blood and potentially even through saliva. So DHEA and DHS, which is DHA sulfate, is the most stable, commonly measured form. In functional medicine, we look at optimal levels, not just within the so-called normal range. Generally speaking, for women, optimal DHEA levels is between 150 to 300, and for men, typically between 250 to 450 micrograms per deciliter. However, the right level obviously depends on your age, your gender, your health status. And again, if your numbers are low, it might just be a missing piece of this COVID recovery puzzle. So what do you do if your DHEA levels are low? Well, let me give you a few steps to naturally support DHEA production. Number one is going to be managing stress as best you can. Chronic stress depletes DHEA levels. Things like meditation and yoga and prayer, breath work, again, these all can help restore adrenal stress response. The next thing you want to think about is getting good quality sleep. Aim for 8 to 10 hours of restorative sleep, deep sleep. This is when your body makes the most out of hormones. Exercise moderately, gentle strength training, moderate walking, stretching, again, grounding yourself. These again all help with DHEA. You want to really avoid overtaxing your adrenals. All right, so next on my list is you want to eat a hormone supportive diet. Well, what does that mean, right? A hormone supportive diet. Healthy fats, healthy good proteins, B vitamins, essential fatty acids, fish. Again, these are all very important. Things like adaptogens, ashwagandha, rhodiola, eleuthera, these can all help balance cortisol levels if your DHEA levels are low, or high for that matter. In more severe cases, low doses of bioidentical DHEA supplementation must be considered, but this should always, again, be guided by lab testing and a knowledgeable functional medicine practitioner. So just a couple of things to remember as we kind of wrap up today's video. If you've been struggling with long-haul COVID-19 and nothing seems to help, don't overlook hormonal health. DHEA may be one of the most underappreciated players in your recovery journey. Again, testing your levels, addressing the root cause of this adrenal dysfunction, and really supporting your body with the right tools can make a world of a difference.